Welcome. We usually think of doctors as healers, right? They're focused on treating one patient at a time. But what if they could also be system builders? What if they had the power to heal the entire healthcare system from the inside out? Well, that's exactly what we're diving into today. I mean, we've all been there, haven't we? Whether you're a patient or a doctor, it just feels like trying to turn this enormous ship with a tiny little paddle. It's a huge challenge, and a lot of the time it just feels, well, stuck. Now, the official term for trying to fix all this is quality improvement, or QI for short. But let's just cut through the jargon. At its core, QI is just about making healthcare better, safer, more effective, more focused on the patient. It's about spotting the problems and actually systematically fixing them. Okay, so everyone agrees that making things better is a good idea. But it turns out there's a critical piece of this puzzle that's very often missing from the equation. Take a look at this number. A study of hospital physicians out in British Columbia found that only 26.3%, that's barely 1 in 4, had ever been involved in any kind of quality improvement work. Just 1 in 4. And that raises a massive question. I mean, doctors are the ones on the front lines every single day. They see the cracks in the system, the inefficiencies, better than anyone. So if they've got the best view of the problems, why aren't more of them helping build the solutions? Where are they? And listen, this isn't just a BC thing, it's a widespread challenge. Another study over in Ontario showed that only about 14% of doctors got any formal QI training from their own organization. So the desire to help is there, but that bridge to actually doing something seems to be out. So if we're going to treat this like a medical problem, our first step has to be a diagnosis. What's the underlying condition here? What's really holding doctors back? All right, this table pretty much gives us the diagnosis, straight from the doctors themselves. When they were asked to rank the biggest barriers, number 1, and this will surprise nobody, was a crushing workload and just a total lack of time. Right behind that, a lack of skills or training, not having access to the right data, and feeling a lack of support from leadership. And you can really feel the exhaustion in what the physicians had to say. One put it so simply, clinical work is totally consuming of available time. There's just nothing left in the tank at the end of the day to take on huge system-level projects. And this creates a really nasty catch-22. Another doctor explained that without the training, trying to do this kind of work takes up even more of their precious time. It's like, being asked to build a cabinet, but they forgot to give you the screwdriver. And then, underneath it all, there's a bit of a trust issue. This quote really gets at a feeling that the administration's main goal is saving money, not necessarily providing high-quality care. And if you feel like you're pulling in opposite directions, you're not going to get anywhere. So it really just boils down to these 3 things: no time to do the work, no training to do it well, and no support to make it a priority. Any one of those is a problem. All 3 together, it's basically a brick wall. But hey, after every diagnosis comes a prescription. And the good news is, there's a proven treatment plan for this. Let's look at a blueprint for change that takes these barriers and just dismantles them. So over in Alberta, a group of physician leaders at the University of Alberta and Alberta Health Services basically said, nope, we're not accepting this anymore. And they created this amazing coalition to build from the ground up a way for physicians to lead these improvement projects. So what was their secret? Well, their blueprint is built on these 6 key ideas. First, they made QI part of the job, not some extra thing. Second, they created accountability, with doctors mentoring other doctors. Third, they made it a team sport. Fourth, they built training right into the culture, from med students all the way up. Fifth, they gave the work real credibility, counting it in performance reviews. And finally, they proved it was a good investment by tracking the impact. And what is so smart about this is how they took every single one of those barriers and just flipped it on its head. Lack of time becomes dedicated time. Lack of training turns into education and mentorship. And that lack of support, it's replaced by real leadership and collaboration. It's a total game changer. Okay, so that's the prescription. But did the patient, the system, actually get better? Let's check the prognosis, because the results, well, they really speak for themselves. First up, engagement. The coalition has already completed over 60 physician-led quality improvement projects. That's what happens when you actually clear the path for people to get involved. And remember that lack of training problem? Well, they've now trained around 650 physicians and medical students in how to do this work effectively. They didn't just ask for help, they built the skills to make it happen. And finally, The money. The coalition has secured over $250,000 in grant funding for these projects. This proves that this isn't just a cost center. It's an investment that actually brings in more investment. The takeaway here is just so clear and so powerful. This isn't some big mystery. When you give doctors the tools, the time, and the support they need to be system builders, the entire system gets healthier. Patients win, providers win, and yeah, even the bottom line wins. So that leaves us with this final, kind of exciting question. The Alberta model gives us a real glimpse of what's possible, and it just makes you wonder, what could our healthcare system really look like if every single doctor wasn't just working in the system, but was an active partner in improving it?